Good afternoon, everyone. I'm Nirav Shah, Director of the Maine CDC. I'm here today with Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to join you all this afternoon to talk about where we are with respect to COVID-19 for the entire state of Maine for today, Wednesday, November 10th, 2021. I'll start by talking about where we are epidemiologically and then turn things over to Commissioner Wambrew for updates. We begin our update today on yet another sad note. Maine CDC is reporting 2 additional COVID-related deaths today. One was a resident of Hancock County and the other a resident of York County. One of these 2 individuals was a woman, the other was a man. One was in their 70s and the others in their 80s. The passing of these 2 individuals brings Maine's total toll of COVID-19 related deaths to now 1,217. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of all of those who have passed away from COVID-19. Right now in the state, we have logged a total of 109,592 cases of COVID-19, an increase of 882 cases since yesterday alone. Our 7-day PCR positivity rate stands at 6.9%. 2 weeks ago, it stood at 5.45%. The testing volume during that time has gone up. Right now, for PCR tests over the past 7 days, Maine has been conducting about 555 such tests for every 100,000 people in the state. 2 weeks ago, we were doing 500 tests for every 100,000 people. So just over the past 2-week period, we've seen an 11% increase in testing volume. And that comes on top of a 20% increase in the 2 weeks prior to that. So our efforts to expand the availability of testing across the state are starting to bear fruit. In terms of hospitalizations, cumulatively, 2,903 people have been hospitalized throughout the pandemic in Maine. And right now, there are 225 people who are hospitalized with COVID-19 across the state. 2 weeks ago, that number stood at 209, representing an increase of 16 hospitalizations just over the past incubation period. Right now in Maine, 69 people are in an ICU bed, whereas 2 weeks ago, there were 74 people in the ICU. And right now, there are 29 people who are on a ventilator, whereas 2 weeks ago, there were 34 people who are on a ventilator in Maine. Turning now to vaccines and vaccinations. As of this morning, 71.2% of the entire state of Maine is now vaccinated, fully vaccinated. And 77.9%, 78% of the entire state has received at least 1 dose. And vaccination rates are continuing to show steady progress. Right now in Maine, we are administering 7,264 doses every single day on average across the entire state. That's a 40% increase in vaccination rates just over the past 2 weeks. And as I mentioned and talked about last week, we are going into pediatric vaccination with the wind at our backs. But all that being said, one of the most common questions that my team and I discuss every single day is, simply put, what the heck is going on right now? How could it be that 2 of the most vaccinated states in the country, Maine and Vermont, are seeing among the highest sustained daily case rates that we've seen since January, perhaps even since the entire pandemic began? What I'd like to do today is talk about how we reconcile the fact that we have amongst the highest vaccination rates, but are continuing to see high daily case counts, hospitalizations, and sadly, even deaths. There are a number of reasons when taken together help explain what we're seeing right now. Let's start with vaccines and vaccination rates. It is true that our overall vaccination rate among all the other states leads the nation. But the vaccination rate within the state shows great variability. As I mentioned a moment ago, right now in Maine, 71.2% of the entire population is fully vaccinated. That's great. But for epidemiological purposes, what matters is simply not the overall percentage of the state that's vaccinated, it's where those folks are. That's because vaccinated individuals, in epidemiological terms, present a barrier for the virus, a blockade that limits the virus's room and ability to run. Here's what I mean by that. If those 71.2% of Mainers were spread evenly across every household, every neighborhood, and every county, our daily COVID case rates might very well be much lower. But instead, what we see right now in Maine, as well as in other states, is some areas with high vaccination rates and others with comparatively lower rates. This means that in those areas with lower rates, the virus has room to run. The difference between our most vaccinated counties and our least vaccinated counties is about 17 to 20 percentage points. In epidemiological terms, that's significant. Even in a highly vaccinated state like ours, what that means is that there are still pockets of unvaccinated people. Those unvaccinated pockets comprise tens of thousands of individuals in those counties who are at risk. And when you add on top of that the Delta variant with its significantly higher transmission rate, what you see is what we see right now. You see COVID thriving in areas of the state with low vaccinations. From the virus's perspective, areas of the country like that are like a literal buffet. Now, on top of the challenge that's created by the lower vaccination rate in these countries, these more rural Maine communities have had lower levels of background immunity because until somewhat recently, they had suffered lower rates of infection throughout the pandemic. Simply put, because they were not previously infected or affected with the virus itself, their overall immunity levels were that much lower. So in big picture terms, there are two things going on the immunity front. The first is their lower vaccination rates, which leads to lower vaccine-derived levels of immunity. The second is, in effect, lower virally derived immunity rates. And that's because these rural communities have been insulated from COVID. In the pre-Delta era, their rurality was somewhat protected, but not anymore. The Delta variant has blown through that insulation. The surges that happened earlier in the pandemic in more densely populated parts of the country, like New York and Boston, and even elsewhere in New England, like in Connecticut and Rhode Island, those surges never really had enough infective force to push their way into more rural parts of northern New England. But Delta is different. It spreads more easily. And when you combine the lower levels of vaccine-based immunity with the also low levels of pre-existing viral immunity, what you get is, in effect, gasoline on fire. What you get is what we've seen, consistently high daily case counts. And unfortunately, this is unlikely to change in the near term. Maine CDC expects that those case counts will remain high in the near term. For how long they remain high is fundamentally up to all of us. Now, there are other drivers that are at play right now. I've already mentioned the Delta variant with its significantly higher infective potential. Climate plays a bit of a role, particularly in explaining not so much why we're seeing the surge, but why we might be seeing it now. Climate does so in two ways. One is simply that more folks gather indoors when it's chillier. The other is that the cooler, drier air makes it easier for the virus to spread and enter the body. There's also the role that kids are playing right now. Children in particular are driving transmission as well as case rates. In the past 14 days in Maine, there have been 1,483 cases of COVID among children 12 and younger. That's 21% of all of the cases reported across the state during that same time window. Now, at the same time, we've got 96,500 5 through 11-year-olds who just became eligible. And as they get vaccinated, which they are, they too will create more epidemiological barriers to block the virus's spread. We're making it as easy as possible for every single child in Maine in that age category and above to be vaccinated. We have over 150 school-based clinics that are happening across the state in the coming weeks. On top of that, as we talked about last week, the Pfizer vaccine for 5 to 11-year-olds is available in pharmacies across Maine, at large-scale vaccination sites like those in Sanford, like those in Auburn, as well as pop-up clinics that hospitals are hosting, as well as increasingly at your own pediatrician or family practitioner's office. So what does all of this mean for you? What are these pockets of unvaccinated individuals, these pockets of individuals with no pre-existing immunity, the Delta variant, the weather, and this surge of cases, what does it all mean for you and your family? Well, the first and most important thing is that none of this is to undermine or undercut the fact that the vaccines and vaccinations continue to work. If you're vaccinated, your risk of getting severely ill from COVID or ending up in a hospital or dying remain low. 99% of all fully vaccinated people in Maine have not gotten COVID. And in any given week, about 2/3 of all the people admitted to Maine hospitals with COVID are not fully vaccinated. The vaccines continue to provide some of the best available protection against COVID-19. If you're not yet vaccinated, particularly if you are in one of those rural pockets of the state, now is a great time to get vaccinated, perhaps alongside your kids. The second thing this means for you is that other mitigation still matters. Testing remains critical, and we're still working to increase the availability of PCR tests and antigen tests across the state. Masking remains important, particularly in indoor public settings in all 16 of Maine's counties. But here's the thing. These things come as a package. Vaccination, whether it's kids, adults, boosters, as well as testing, indoor masking, staying home if you're sick, washing your hands. None of those background preventive measures have gone away. Indeed, they remain part of the package, especially for the duration of this year, and certainly over the holidays. Each of these components count, and taken together, the sum of these is greater than each of their constituent parts. Until we have the highest possible vaccination rate that any of us can imagine, the best thing for each and every one of us to do is to go out there and get ourselves and our families vaccinated. So with that, I will turn things over to Commissioner Wambrew.
Thank you, Director Shah. Today, the Maine Department of Health and Human Services published updated data showing that 97.7% of Maine healthcare workers were fully vaccinated for COVID-19 at the end of October. This continues a significant increase in vaccination that we saw in September. For comparison, the US CDC reports that the adult vaccination rate in Maine is 82.3% and is 70.1% across the nation. The number of unvaccinated workers reported by healthcare facilities plummeted by 14,810, or 92%, between May and October. To Today, the Maine Department of Health and Human Services also issued the final rule that adds COVID-19 to the set of vaccinations required of designated healthcare facility workers. After taking public comment, this final rule incorporates feedback, adopts some clarifying guidance, and replaces the emergency rule, which has expired. The fact that nearly 100% of healthcare facility staff are vaccinated demonstrates that the policies that Maine has adopted have worked. They are protecting these critical workers, their patients, their residents, and their capacity to care for people with COVID-19, as well as other serious health problems. We urge all Maine people to get vaccinated. It's the best and most effective tool we have to protect our frontline workers, prevent serious illness, and turn the tide on this deadly pandemic. With that, I'll turn it back to Director Shah for questions.
Great. Thanks, Commissioner. We will turn to our colleagues in the media. And the first question for the afternoon goes to Chris Costa.
Hi, Dr. Shah, Commissioner Lambrew. Thanks for taking our questions today. Dr. Shah, this question is for both of you, but Dr. Shah, you mentioned it briefly in your monologue about children and the spread of the virus. We've seen a lot of schools that have issued the need to either close or go remote due to not only kids spreading the virus, but also staff getting infected or having to quarantine or isolate. We've seen this in a number of school districts already. I know that this is an interconnected issue, as you mentioned, the hygiene, vaccines, masking, etc. But there are a lot of people right now who are feeling like they're in a difficult spot. Districts who would love to offer in-person learning, but are now short-staffed. And also parents who are saying, I don't want my kid to get sick, but how do I find coverage for my kid if I have to go to work and they have to remote learn at home? Do you have any advice or recommendations that you can provide to one, school districts, and two, parents to help them with this issue? And Commissioner Lambrew, obviously this question's for you as well.
Maybe I'll begin and then Director Shah can jump on in. So we are absolutely committed to trying to promote in-person learning across the state of Maine. This is why we promoted pooled testing to any school that is interested in taking it up, why we continue to urge school districts to adopt universal masking, other protocols to keep kids, staff, and teachers safe in schools. And as a reminder, people who are fully vaccinated, even if they're a close contact, they don't have to quarantine if they're fully vaccinated and get tested 5 to 7 days after that exposure. So we think the tools are there to protect in-person learning. We continue to provide technical assistance, whatever support we can to promote that outcome. But it does require that people take advantage of these options, sign the consent form for their child to participate in pooled testing. Staff should participate in pooled testing. Staff and now kids 5 and older can get a vaccine. So it does require individual action as well as action by school leadership. But Director Shah, anything to add?
No, I concur completely, Chris. And I'm aware of at least one school in Androscoggin County that's moving to remote learning on Friday for various reasons that they enumerated. But what Commissioner Lambrew noted is exactly right. The best way to prevent that happening is to ensure that vaccination rates are as high as possible. As much as the commissioner and I are pushing for in-person education, we know that teachers are doing the same thing, if not more. They, of course, see the value in having kids in the classroom 5 days a week, being there, being present. So we know that those decisions to move, say, to remote, don't come easy. They're difficult and they're not easy to make. That being said, things like vaccination, pooled testing are ways to keep at least the children in the classroom. And then, of course, the more staff who are vaccinated just statistically lessens the likelihood that schools will have to close because so many staff might be out because they got COVID. So once again, the same tools that we've recommended for different groups across Maine, in this case, schools, have just a tangible benefit of not just keeping the teachers and staff safe, but also allowing kids to be back in the classroom. It's very difficult. We get how hard it is. These are really hard times, and we're absolutely willing to work with schools to make this happen.
Okay, thank you both. My second question, this comes from a viewer. And I don't know how isolated or perhaps maybe widespread this issue is, but it seems to kind of harken back to when we had the first round of the vaccines open up. It's a mother saying that she would like to get her child vaccinated, who's between the ages of 5 and 11. They struggled to get an appointment at the Auburn Mall. She had cited that maybe they didn't have doses at the time. I have not had a chance to go and independently confirm that with the hospital, but the general theme is when she couldn't find a spot there, she tried to find a spot at a pharmacy. She said that the pharmacy appointments were booked for quite a few weeks, and that it would lead to her child not being fully vaccinated until possibly after Christmas. Is there any consideration on the state's part at this point? I know that you guys are working extensively with schools to provide these school-based clinics, but is there any indication right now that needing another mass vaccination site, perhaps like a Scarborough Downs or a Cross Insurance Center, in addition to the ones at the Auburn Mall and the Sanford site, might be forthcoming?
Well, Chris, I'll start. Certainly that's something we've thought about, we've considered it. The reason that we haven't moved to open up more sites of that nature is, first of all, a lot of hospitals themselves are having very large clinics. For example, Mercy Hospital this Saturday is doing a very large event. Mid-Coast Hospital has been doing so in their catchment area as well. Part of the reason why the larger sites, although the two that are open, we're continuing to support, what we've heard from parents is that their preferences for where they'd like to see their children get vaccinated are in some ways different from adults back earlier this year. A lot of parents have expressed a preference for a smaller, less crowded setting, namely at a school-based clinic or even in the doctor's office. It's one reason why in this situation, we've really tried to blanket places like community pharmacies and doctor's offices, because that's where parents have indicated, and schools, because those are the settings that they're used to and where a lot of parents nationally have indicated that they'd like to get their children vaccinated. That's why we've taken the approach that we've taken. More sites are coming online. Every single day, we're adding more school-based clinics. This morning, we started the list in the 130s. It's now in the 150s, as you heard me mention. And we're working with some of the larger sites, even the Auburn Mall, for example. They're getting their shipments and are hoping to start in earnest soon. So the system is spinning back up to the levels that we saw earlier. But there too, we do ask for a bit more patience. We're also trying to secure more vaccine for the state so we can meet all the demand that's out there.
Okay, thank you both.
Thanks, Chris. Let me go to Brian Sullivan next.
Thanks, Dr. Shah. I'll start with a question for Commissioner Lambrou, and forgive me for not knowing, but the vaccine requirement you just announced for COVID-19 for healthcare workers, how is that different than what went into place on October 29th or in effect on October 29th?
So what happened is that we issued an emergency rule in August that lasts 90 days. Simultaneously, we proposed a final rule that included some of the guidance that we've been putting in FAQs, like who is an employee, what about fully remote workers, other sorts of nuances that we did incorporate into this final rule. For the most part, it's the same. We really did refine it, recognize the changes that have happened between August and now in terms of other types of policies that are out there. But for all intents and purposes, it's the same.
Okay, thank you. And then this next one is just probably for both of you, but a lot of vaccine clinics for the kids going on this week, 5 to 11-year-olds. Just any numbers as to how many shots have been given out or doses, and how's it going? You know, I've heard a couple things, maybe anecdotally a little slower than we hope to get some of those shots out there, but hey, maybe I'm wrong. It's happened before. So what are you guys hearing so far?
I can start, Brian. Really pleased with the rollout so far. And these numbers are on our dashboard, but we've so far administered about 3,150 or so shots into children 5 to 11. Now that's an undercount because vaccinators have 24 to 72 hours to report their vaccines up to the state, depending on what type of vaccinator they are. So we know that there's more going on. And as you heard me chat about with Chris, we're hoping to pump up the intensity of that going into this weekend, where there are a lot of really large clinics that are happening. I know of a bunch of schools in big districts that have clinics, as well as some that are being sponsored by hospitals. So we're hoping, as we've done throughout, which is to keep turning up the dial. I'm pleased with where we are. My goal is to try to turn that up from whatever we're at right now to past 10.
Okay, thank you both.
Joe, over to you.
Yes, hi. Thanks for the Spinal Tap reference. My first question is about Kennebec County. They saw their largest single day increase with 177 new COVID cases. I know there's widespread transmission around the state, but is there anything in particular about Kennebec County that's driving that? Are there any significant outbreaks or?
Yes. So there's two things, Joe. One is, as you've seen, there has been a bit of a carousel effect. Sometimes counties are really high and then they fall, and then another county comes back up. Kennebec is at a high point right now. There is at least one outbreak that we are working with at the Veterans Home that seems to be driving some of that. So that's a concern area. But the bulk of it is just this rotating community transmission, with sort of some counties being very high and then others being lower, and then the counties sort of flip-flopping throughout. So it's a bit of both in Kennebec right now.
Okay, thanks. And in terms of the pediatric vaccinations, it occurs to me, especially in some schools where maybe the 12 and older vaccinations were slow early on, but now, their brothers and sisters are getting offered the vaccine. Is there any thought about also having 12 and older clinics at schools?
Yep, some are doing it. What we've said to providers, Joe, is if it is within your purview and workflow, not purview, if it's within your workflow to offer adolescent vaccines alongside the childhood vaccine, we will support that. In fact, we've gone even a click further, Joe, and said, if it's also within your purview to offer the flu shot alongside the children or the adolescent vaccine, we'll support that too. Different providers are taking a different tack. Some, working with their local schools, have said, we just want to be laser focused on the 5 to 11-year-olds. Others have said, yeah, we want to make this an all in the family. So it really is something where we've said we want to follow the lead of what the communities are looking for and asking for, be it the schools and the vaccinators. And then on our end, we'll support that with the supplies and the vaccine that they've requested.
If I can squeeze in one last, this is just a number question. I know you said 99% fully vaccinated have not caught COVID in Maine. And I know there's the official statistics of how many people have caught COVID, but I understand it's more people have caught COVID than the official statistics. So is there any estimate for the unvaccinated population, what percentage of them have caught COVID?
There are such estimates, Joe, and these are based, and we'll get you the links for where those data are, but there is a very large-scale project that the US CDC has been operating in conjunction with large private labs, Quest and LabCorp, to do that sort of background analysis to try to get at the point that you're raising. Those data are on the US CDC's website. They're publicly available. They're pretty interesting. And when you take a look at them, what will jump out at you is, well, what I mentioned in what I guess people are now calling a monologue. All right, fair enough. Which is that the background rates of people with pre-existing antibodies from prior infections in Maine and Vermont is really low compared to the South, the Southeast. And so that's one of the epidemiological factors. Again, those data are on the US CDC's website. You can probably use whatever search engine you prefer and find it. If not, we'll send it over to you. Let me go to Emily at the Sun Journal.
Hi, good afternoon. So I have two questions. One about the latest healthcare worker vaccination rates. So I'm looking at these numbers, and it seems like it still ranges. Everyone's in the 90th percentile, but I'm looking specifically at Central Maine Medical Center and Maine General, which have more than 200 unvaccinated staff members. So can you explain what's going on there? I mean, are those 232 people all people with medical exemptions?
So I think each facility will have its own answer to that question. We do know that some of our facilities have put some of these workers on unpaid leave or leave, for example, as they may be getting their full vaccination. There's going to be, I think, a different answer for each one of them. We are, as previously announced, going to be working with all the organizations that are not near full compliance to find out what's going on, and to work to bring them into full compliance. We are transitioning out of a survey mode into the compliance mode, and by mid-December, there'll be an annual report that will be required of facilities subject to the rule, and that will help give us, again, complete information on what's going on.
Okay, and my next question on staffing shortages, specifically at nursing homes. I think maybe Commissioner Lambert, you can answer this. Can you kind of give an overview of what that's looking like right now? If any of those state initiatives are really making a difference? And then lastly, if a nursing home does close, do they have to notify the state? And is that public knowledge?
Yep, so we continue to work on a daily/weekly basis with our nursing facilities. We certainly have really prioritized those that have cases of COVID-19 or outbreaks to make sure that they are protecting their staff, protecting their residents. We do all sorts of support for them, from helping to deploy some contract nurses to fill in gaps, to providing them flexibilities from some of our different rules so they can really maintain safety of those residents. We have continued to work with them on resources and have moved out on the $143 million in one-time supplemental payments for hospitals and nursing homes. That has, I think, made a difference, because we are seeing some nursing home beds open in the last few weeks, which is encouraging. We know there's more work to be done, but we continue in all of the above strategy. So again, daily, weekly, work with our nursing facilities to try to make sure that they have the capacity to open more beds, not just prevent closures. And on the closure side of it, there is an obligation when a facility is closing that they notify our Division of Licensing and Certification with a plan for orderly transfer of those residents to make sure that they are safe in the closure process. There have been no new notices of closure for, I'm going to say, several months, if not weeks. So there's been nothing in the recent weeks.
Okay, thank you. Just real quick, when those notices do go out, are they posted to the like the licensure website or some other public place?
Yeah, and I think I'm going to defer you to our Division of Licensing and Certification for a clear answer. I will say the primary purpose of it is to notify the residents, their families, so that they have information and clear information on the plan. We also get the long-term care ombudsman involved to make sure that that office is helping in these care transitions.
Okay, thank you.
Thanks, Emily. Amy Brown, over to you.
Thank you, Dr. Shah and Commissioner Lambrew. I have a couple of questions from listeners, but just real quick, a number clarification. When you talk about people who have who are not fully vaccinated being hospitalized, I don't think you are, but are you including people who qualify for boosters but have not received them? So are they among the not fully vaccinated now?
They are not, Amy. I'm glad you raised that. It's a good question. The definition of what it means to be fully vaccinated has not changed since the early days of vaccination. That is to say, 2 weeks after 2 shots of Pfizer and Moderna, or 2 weeks after a single shot of J&J. That has not changed. Could it change in the future? Perhaps, but we're ways away from that.
Oh, okay, so it's possible that some of the people who are fully vaccinated but being hospitalized are among those who've not received boosters and their immunity is wearing off.
Well, it is possible, and that has happened. Those individuals have tended to be a bit older and have had a much higher likelihood of having chronic or background medical problems that have both been the reason why they may have been more susceptible to COVID, as well as why they may have landed in the hospital.
Okay, great. Thank you. The listeners' questions. The first one, they say, we understand that there would be less Delta, less potential for transmission, including breakthrough cases, and less opportunity for possible worse strains to develop if more people got vaccinated. But some people who do not want to get vaccinated are pointing at breakthrough cases as a reason to not bother. What do you say to those people?
Yeah, also, thank you, Amy. That's, it comes up a lot. A lot of folks were under the assumption that the vaccines were 100% effective. And no medical treatment in the history of medicine has been 100% effective. And if that's the standard before you will take a drug or a procedure or use a device, it's going to be really hard for you to get on board with anything. Tylenol is not 100% effective. No antibiotic is 100% effective. No surgery is 100% effective. What we do have are vaccines that are on the order of about 90 or so percent effective, 85 to 90+%. In the world of vaccines, that's a once in a lifetime type of thing. That is just how good these vaccines are. Are they 100%? No, nothing ever is. And that's why we do see about 1% of vaccinated people so far in Maine who have had a breakthrough case. That's expected, it's mathematically in line with what we would expect to see. And it's not different from the way that the vaccines were discussed or it's not different from the way they were sold, I guess is what I would say. And the question there is, what's the bigger risk? Would you rather go into COVID with the vaccine on board or without any protection from the vaccine on board? And for me, every single day of the week, the answer is I'd rather, if I'm going to get COVID, go into it with the protection of the vaccine.
Great, thank you. And the other listener has a question about a specific outbreak at a specific school. They have a child who attends the Ellsworth Elementary Middle School where he says there have been 13 positive cases and roughly 150 students and staff identified as close contacts. It's listed on the DOE website as an outbreak. And he would like to know how many of the positive cases, if you do know, are a result of school transmission versus community transmission. And is there a way that parents can find that out and kind of gauge how well their schools are doing about not having transmission in the school?
It's a great question as well, Amy. It does vary outbreak by outbreak. In outbreak terms, if you've seen one outbreak, you've seen one outbreak. They all vary in their various complexities and complexions. I can't speak specifically on the Ellsworth one. We'd have to check. And the thing is, though, what we know about outbreaks, particularly in school settings, is that the more mitigation measures that are in place, be it vaccination levels, be it masking in the school, the more of those that are in place, the lower the likelihood of any in-school transmission. This comes partly from a series of papers that the US CDC published around about a month ago with some data from Arizona and some other states. And so while it may be difficult to discern whether any particular case or any particular student in an outbreak got COVID in the school setting or in the community, what we know is that the best way to prevent more cases from happening is for all of these mitigation measures to be on board. And of course, now with the addition of 5 to 11-year-olds, that can help make schools that much safer.
Thank you.
Thanks, Amy. Megan, over at WMTW, over to you.
Thanks for taking our questions. This is sort of like Amy's question, but kind of in reverse. And it's actually a question from a viewer as well. So 2 initial vaccines, those first 2 vaccines is considered fully vaccinated, but is there any such time frame or factor for a booster?
Not at this time, Megan. Although, and let me just, I didn't get to say this in connection with Amy's question. You're eligible for a booster. You should go get one. But getting that booster doesn't change your vaccine status. You were fully vaccinated before, and you're fully vaccinated after the booster. The booster doesn't change that. It's a good thing to do. I urge folks who are eligible for a booster to go get a booster, but it doesn't change how we think about that term fully vaccinated. Not at this time.
Okay. And second question, I took a look at the vaccine dashboard for kids ages 5 to 11. As of yesterday, of the 3,000 or so kids who have been vaccinated, 44%, it looks like, so like roughly half are in Cumberland County. Is that a reflection? Is that a metric that's a reflection of interest, access, or just maybe clinics in other parts of the state happening later? Is that number at all mean anything in terms of overall vaccination for or interest ages kids 5 to 11?
Megan, Commissioner and I hear where you're going. We appreciate the instinct to look for a trend, but it's too early to say anything at all on any of the axes that you outlined. There are clinics that are going to be happening across the state this weekend. I know there's big ones at Oxford, and it's just way too early to tell and discern any type of trends. Hear where you're going. We've been trying to do the same thing on our end, but it's just too early to tell.
Okay, thanks.
Yep. Patrick, over to you.
Thank you very much. You mentioned earlier that you don't see this sort of trend of higher daily case counts reversing itself anytime soon. Why specifically do you think that?
The commissioner and I were just discussing this exact issue, Patrick. So let me divide it into two periods of epidemiological time. In the near term, by which I generally mean the next incubation period, 2 weeks or so, it's unlikely that these sustained high levels of cases are going to turn. It may even be 2 or 3 incubation periods. But beyond that, where we go really depends on the extent to which individuals get vaccinated, or somewhat morosely, the extent to which they get infected, both of which will generate that immunity that will ultimately see a decline in cases that are spreading right now among rural communities. So in the near term, these sustained high levels of cases are likely to continue. But in the medium and longer term, more than a few incubation periods out, that's up to us. If folks who were unvaccinated across the state of Maine decided that this was the weekend for them, that they were going to go with their kids and go get vaccinated, then we would start seeing the impact of that as soon as 2, maybe 3 incubation periods from now.
So essentially, to get an idea of when this could start turning in the other direction, we probably need to wait multiple incubation periods. It sounds like
at least 1 or 2. I don't want to make any predictions, but it'll take us a bit more time to see kind of where we are on the curve. And as you know, Patrick, from our conversations throughout the pandemic, one of the questions when we're looking at a surge, whether it's an outbreak or as a state, is where on the curve are we? Are we on the upswing still? Have we peaked out? Are we starting to see the decline? Based on the data that we've got and the models and the way that we think about it, we're still likely on the upswing. Are we close to the top? Are we midway there? That's what's going to take us a bit more time to sort out. But make no mistake, what can turn that curve is more folks getting vaccinated.
I see. And can either of you speak to the disaster relief payments that are going out to individuals over the next 6 weeks? Sounds like those were going out by postal mail. Is that right?
Yeah, I think we would have to defer you to our different commissioners on that particular question. Apologies.
Okay. Well, thank you very much.
Thanks, Patrick. Kevin Miller, over to you.
Great. Thank you very much. So kind of expanding a little bit on a question that Megan asked, looking at the geographic, not looking for specific trends, but can you talk about any special strategies that you're going to have to make sure that the geographic distribution of vaccinations is perhaps more even than we're seeing with the adult population? Because you talked about the pockets of unvaccinated people we're having is driving up the caseloads likely in the state. Can you talk about any kind of strategies for making sure that vaccines are getting out to all the rural school districts and rural areas of the state, and any outreaches you're doing to parents in those areas as well?
100%, Kevin. Commissioner and I have spent a lot of time planning, discussing, dissecting this. I'll start here. The first thing that we've done in terms of our planning is to reach out to schools directly, every single district, every single RSU, to ask them where they are in terms of their vaccination planning. Some have said, yep, we wanted clinics. Some have said, we'd like to join up with 2 or 3 other adjacent schools. Some have said what makes the most sense for our community is to partner up with the hospital and do it at the hospital. But the net that we cast was not one that was limited in any way by geography. We went district by district in partnership with the Department of Education. So starting at baseline, we wanted to cast the widest geographic net in our school-based approach. The second thing that we looked at were the commercial and chain pharmacies. They are, as we've talked about, for many places and communities in Maine, they are the healthcare. So we made sure that commercial and chain pharmacies in Maine were getting on board with pediatric vaccine. Not all of them have yet. That too is going to take a bit more time, but many have. For example, every single Walmart in Maine is administering the 5 to 11 vaccine. We're looking to bring on more and more. For example, we're making sure CVS has got what they need, working with Shah's to get those places spun up as quickly as possible. And then finally, the third element of this from a geographic equity perspective, but that we should also toss in other forms of equity, are doctors' offices themselves. For a lot of folks who are hesitant, be it because they don't have all the facts or because they don't want to be out there with others, with their kids getting vaccinated, the doctor's office is the place to be. And so for this particular effort, we redoubled, tripled our efforts to get the vaccine into primary care offices. And we're starting to see the fruits of that. Some of the largest pediatric practices in Maine are now carrying the vaccine in a way that we didn't really see as much of a feature with the adult vaccine. So this geographic, as well as other equity piece, Kevin, was really the cornerstone of our planning. It wasn't so much about efficiency as it was with the adult, as you heard me talk about 10 months ago. Equity was the overarching principle.
And great. And just one quick follow-up when you talked about the larger scale pharmacies, CVS and Shah's, things like that. And I apologize if you've talked about this before, but are there specific needs that they have that for reasons why they are not offering the vaccine to kids yet? Is it that they don't have the right syringe sizes, things like that?
Kevin, for the bottom line answers, I would refer you to CVS and Shah's. But what has been communicated to us came down to staffing. There are probably others, and I don't want to speak for them. That's just based on my interactions with them. It wasn't a no, it's we need a bit more time. But in terms of the ancillary supplies that you mentioned, syringes, stuff like that, that all comes with the vaccine. So when Maine CDC submits an order to the federal government for 500 doses of vaccine for location X, not only do they get 500 doses of vaccine, they get all of the syringes and Band-Aids and whatever else are needed, the so-called ancillary supplies, to make that vaccine turn into a vaccination.
Okay, great. And then just one quick numbers question. I think you said earlier that it was about 1,400 cases in the past couple of weeks among children, new cases.
Yep, go ahead. Sorry,
and I was just going to ask, are you seeing an increase in pediatric hospitalizations, or are those still relatively low?
Great. Thanks, Kevin. Let me give you the numbers first. So in the past 14 days, the past incubation period, there have been 1,483 cases of COVID among children 12 and younger. I'm realizing when I ran that code, it should have been 11 and younger, but it's 12 and younger, and that is 21.25% of all of the COVID cases reported in the state over that past incubation period. We've seen a small uptick in hospitalization rates. So let me give you those numbers. Right now, based on the data reported to us, there are 5 children in Maine, and by children, I mean under the age of 18, not 5 to 11, but 18 and younger. There are 5 who are currently hospitalized, 6 in the past 30 days, and of those 5 who are currently hospitalized, 1 is in the ICU. That is a very small uptick, Kevin, since last Thursday. And I don't know if it is just a blip or if it is a trend. We don't have enough data because it's just a couple days and the numbers are so small. So I cannot call that a trend, something we're keeping an eye on, but that's where we are.
Great, thank you.
Yep. Let me go over to Evan next.
Hey, Dr. Shah, thank you. We've obviously talked a lot about the vaccine mandate for healthcare workers in Maine. I'm wondering, given the numerous COVID outbreaks we've seen in prisons and jails, why did that mandate not apply to corrections officers? And as the Press Herald reported last month, even those corrections officers who work providing medical care.
Sure. As a reminder, the Maine Department of Health and Human Services rule does apply to facilities that are licensed by the department. We do not license corrections facilities or the clinics that are served within them, so it's outside of our scope. I would note that the OSHA rule that was recently promulgated by the U.S. Department of Labor does apply to private sector employers with 100 or more employees. The U.S. Department of Labor has told Maine Department of Labor that we are a state plan state. That means that that rule would, with adoption by our Board of Occupational Safety and Health, apply to our public sector employers with 100 or more. So it may be that some of our personnel in the county jails will be subject to the OSHA rule, but that's to be determined by Department of Labor, both federal level and Maine Department of Labor.
And would that apply to all of the state prisons? Would they all be above that 100-person threshold?
So the state of Maine is an employer that has more than 100 employees or 100 or more employees. So we do anticipate that when, again, the Board of Occupational Safety and Health does vote to adopt the U.S. Department of Labor rule, it would apply to the state of Maine, but that is to be determined based on the outcome of that board vote and subsequent policy.
So it would apply to the prisons, but it's not clear if it would apply to every county jail because of that number of employees.
Yeah, generally, I think that's right.
Great, thank you.
Thank you.
Great,
And I would just note one quick note, talking about the department's rule. I earlier said that for all intents and purposes, the final rule hasn't changed from the emergency rule. I would just note that because the Emergency Medical Services Board did adopt its own rulemaking, the final Maine Department of Health and Human Services rule did remove EMS organizations to avoid any conflict or confusion with that Bureau's rule. And upon review of data and comments that were submitted on jurisdiction, we did remove dental health practices from the rule as well.
Let me go to Annie from Spectrum News next.
Hi, thanks for taking my question. Just really quickly, is there a target percentage of the school population or even within individual districts that you want to see vaccinated by the end of the year, or some like epidemiological line where it would make a particular difference in limiting school spread?
Annie, there's not a target that we've got that we're aiming for other than every single eligible child. And that's really the bottom line. I know that sounds a bit jingoistic, but we want every kid in Maine, 5 to 11, 5 and over for that matter, to be fully vaccinated. So that's what we're striving for, and nothing less than that. And in keeping with Kevin's question, we're trying to make it geographically easy for kids to get vaccinated. That will hopefully get easier as time goes by. Now, epidemiologically, in light of the Delta variant, we don't really start seeing significant benefits at a community level. I'm not talking about at an individual level, but at a community level. Because of how infective the Delta variant is, you don't really start seeing aggregate community benefits until you get into the 90% range or so.
Great, thank you.
Mm-hmm. And finally, the last question for the afternoon goes to Leah Russell.
Hi, Dr. Shah. Thank you. My question was that about 3,100 children, 5 to 11, have now received their first Pfizer dose, which is about 3% of that population statewide. And I know it's early, but how does that number compare to what the Maine CDC had projected at that point?
I'd say, Leah, we're where we wanted to be. We are in line with what I was hoping we would see in terms of uptake and turning up the dial on the intensity, the availability of vaccines. We're also in line with what we're starting to see rolling out in other states as well. So I don't have concerns at this point. The real question on the table is, where do we go from here? Here's what I mean by that. National surveys have indicated that there are about a third of parents who will absolutely very quickly get their kids vaccinated. And then another third, or maybe 40%, who want to wait and see. And then another group that right now aren't on board with the vaccines. Now, we've seen throughout the vaccination that individuals who on day one said no way have ultimately gotten what they needed to come off the fence and get vaccinated. The question here, as we're thinking about the future of childhood vaccines, is what will that look here? Will states across the country, including Maine, top out at 30%? Or will we be able to furnish and equip parents with the info they need to get that number as high as possible? That's really the task in front of us right now.
Mm-hmm. And I had a second question, if that's okay. So we've seen a bunch of schools, at least here in Penobscot and Hancock counties, that have had to close temporarily. Have any schools had difficulty in conducting pool testing programs? And if so, is there anything the Maine CDC can do to help them get those programs going?
So your question was, go ahead, Commissioner.
Yeah, I'm not aware of any school that has had serious problems. We do have technical assistance that is provided by the company that we partner with to do this. We have also a team of school nurses who work at the Department of Education who are there to help support pool testing. So when there are challenges, we jump in to try to help. We really do believe that, as has been proven by the over 300 schools participating in school pool testing, it can work, it has worked, and we do encourage more schools to take up this option.
Thank you both.
Thank you, Leah. I want to just mention two things before we wrap up. The first is a question that came in just a bit later around boosters, particularly the news that Pfizer may be requesting more widespread access to boosters. Those data haven't been published yet. FDA is still reviewing them. And so at this time, it's impossible to comment on whether the Pfizer booster for 18 and over is something that should be authorized by the FDA or will be. But here's what I will say. If you're eligible for a booster, again, you should go get one. And I'd urge everyone to take a hard look at just how expansive the eligibility criteria are. Certainly, it's folks over the age of 65, but it's also folks who have pre-existing health conditions, including things like being overweight, as well as having things like diabetes, which when you look at the population level is a lot of folks across the country, a lot of folks in Maine. It also includes folks who or work in settings where they might be exposed to or potentially transmit COVID, which is a lot of settings across the state. So I'd ask folks to take a look at that. If you're eligible, I recommend you go get a booster. The last thing before we close this evening or this afternoon is Commissioner Lambrou and I wanted to note that tomorrow is Veterans Day. And we wanted to take a moment to thank all of the veterans across Maine for their service to our country. We also wanted to take a second to note and remind folks that there are an innumerable number of veterans right now, today, who are involved with our COVID-19 response across Maine CDC, across Maine DHHS, across the entire state. And so we wanted specifically to thank those individuals for their continued service, especially right now when we need it. So with that, Commissioner, anything else on your end? Okay. Well, thank you all for your time this afternoon. We appreciate our colleagues in the media, as well as all of you for taking some time to join us. We hope that everyone has a great day. We will see everyone soon. Take care.